Hello, everyone. This is Charmaine Anderson, Director of Advocacy for Allergy and Asthma Network. Thank you for joining this webinar today in preparation for Allergy and Asthma Day, Capitol Hill, which is next week. A few housekeeping items. The webinar will last between 45 minutes to an hour. I hope to move at a decent pace through the presentation to have time at the end for questions. Please remain on mute for the webinar, and I will answer as many questions as time allows at the end. Use the chat function on your screen to type questions anytime during my presentation. The recording of today's webinar will be posted to our website, and at this time, I will pause for a bit while I start the recording. Thank you in advance for holding. Good afternoon. My name is Charmaine Anderson, Director of Advocacy for Allergy and Asthma Network, and I will be conducting today's webinar in prep for Allergy and Asthma Day, Capitol Hill, also known as AADCH, a week from today on Wednesday, May 3rd. We are excited about the upcoming event, and I would like to acknowledge the American College of Allergy, Asthma, and Immunology and say thank you for their continued support year after year. We couldn't do this without them. Today, I'm pleased to be joined by Christopher Cush, CEO of Soapbox Consulting, who will discuss all things schedules and meeting logistics during the webinar. Soapbox has been a partner with the network since 2016 and has been instrumental during AADCH of getting everyone where they need to be when they need to be there. We appreciate their partnership over the years, and we certainly couldn't manage all they do alone. Our mission and our core belief is together we can work to end the needless death and suffering due to asthma, allergies, and related conditions through our 4 mission areas of outreach, education, advocacy, and research. And we thank you for helping us in your work and in your communities and by lending your voice to advocate on issues that matter. So what will it take to support those living with allergies, asthma, and related conditions? We believe improving access to medical care and treatment, asthma and allergy program funding, reducing health risk for allergy and asthma emergencies, mitigating environmental health hazards, improving health equity. These 5 policy priorities drive our federal and state legislative activities as we work so patients can achieve optimal health outcomes. Our key advocacy issues for AADCH align with the network's policy priorities and our current engagement at the federal level. The bills shown are pending in Congress, and we are asking for members to support them in hopes to get them through the congressional process and signed into law. A few things to point out. You will notice that the bills start with either an S or HR. S means Senate, HR stands for House of Representatives. That designates and tells us which chamber of Congress introduced that bill. As you can see, the Safe Step Act was introduced in both the Senate and the House of Representatives. Most times, a bill can be introduced with the exact same language in both chambers in hopes to get it to the finish line more quickly. The other thing you'll notice is that there are names of committees that each bill was assigned to, just so you can have that by way of reference, as Soapbox will include that on your schedules also, so you can see if your member is either on the Senate committee or a particular House committee where these bills are being considered. So first up is the Safe Step Act. To give you some understanding of what step therapy is, health insurers often use step therapy to control cost. Step therapy occurs when insurers require patients to try and fail on one or more medications. Typically, this occurs with a generic or low-cost drug before the plan will cover the treatment initially selected by the patient and their healthcare provider. Delays in getting the proper treatment can lead to a patient's medical condition getting worse and increased costs. Asthma medications are especially prone to step therapy because health plans frequently change the list of preferred medicines they will cover. The Safe Step Act puts common sense requirements and timelines around the practice of step therapy and gives patients and their doctors a way to appeal step therapy requirements when a patient's need a particular treatment. The Help Copays Act is, to give you some understanding, many of us rely on manufacturer cost-sharing assistance, which includes discounts, coupon cards, and vouchers, which help cover the portion of a medication's cost, making it more affordable. Historically, when someone uses cost-sharing assistance, the amount is counted towards their insurance deductible and maximum out-of-pocket limit. However, recent policies, mainly by health insurance companies, block these contributions from one's deductible and out-of-pocket maximum, resulting in more cost for you to pay for your medication. The Help Copays Act would require health insurance providers to count copay assistance towards a person's insurance deductible or out-of-pocket maximum. Next is the Protecting Children with Food Allergies Act. Food allergies affect 32 million Americans, including 6 million children. Like asthma, students may experience their first anaphylactic episode at school, and we want school personnel to be prepared to help. This bill would require food allergy training for all food service personnel in public schools K through 12. Training is to include how to communicate food allergen information in school menus and food products, ways to avoid cross-contact, identifying food-related allergic reaction symptoms, and responding to food-related allergic emergencies. Next, we have the One School, One Nurse Act, which addresses the shortage of school nurses. There are over 50 million school-age children in our country, and yet nearly 60% of schools have a higher ratio of students to available nurses. As we all know, school nurses are the health expert in our schools. And as the number of students with medical needs continue to rise, it is vital that students have regular access to a school nurse. This bill would fund a grant program that would support a full-time registered nurse at public K through 12 schools. Specifically, the funding would be directed to recruit, hire, and retain school nurses. And then last but not least is funding for allergy and asthma programs in the next fiscal year, which begins October 1 of this year. There are a number of programs that Allergy and Asthma Network support, which are listed here, which really support the research and outreach initiatives, as well as education that some of these federal agencies provide. With one exception, as far as federal funding, is the last bullet point about the U.S. Department of Agriculture, where we are seeking federal legislation, or language, I should say, that speaks to the manufacturer labeling requirements for sesame. By way of background, in 2021, Allergy and Asthma Network and a number of other stakeholders worked to get the FASTER Act across the finish line and signed into law. The FASTER Act stands for the Food Allergy Safety, Treatment, Education, and Research Act, which requires manufacturers to list sesame as a food allergen if the ingredient is present in packaged foods. Unfortunately, in the months leading up to the law's implementation, which was this past January 2023, Individuals and families have reported that sesame was showing up on labels for previously safe products. Some manufacturers across the country have begun unnecessarily adding sesame seeds or sesame flour to their products, rather than taking steps during production to prevent sesame cross-contamination. Others added sesame seeds to their ingredient list without actually adding them as an ingredient, primarily as a precaution in case sesame seeds are carried over accidentally in their manufacturing process. This is concerning and dangerous because not only have the food options for individuals with sesame allergy been reduced, but individuals who have purchased previously safe items without visible sesame seeds may be put at risk if they assume those products remain safe. We want FDA, the Food and Drug Administration, to discourage this practice and bring attention that this is harmful to consumers who live with food allergies, particularly sesame. There are 5 members in Congress who submitted language requests to the subcommittee that oversees funding for the Department of Agriculture, which would require FDA to clarify that manufacturers may not add sesame to an ingredient list when not an ingredient, or mislabel packages for sesame to avoid the new labeling requirements under the FASTER Act, and to convene experts to work on this mislabeling solution. We encourage you to utilize social media as it relates to not only those bills, but your experiences with us during AADCH. I've listed here our tag for both Facebook and Twitter. We also encourage you to utilize social media channels on Twitter and Facebook to connect with your elected official. Members and staff take note oftentimes and will respond directly to your post, or even like your post or share your post. Members of Congress use social media to spread awareness about issues they care about, to update their constituents on events, to discuss public policy, and highlight organizations or constituent groups they meet with. We will be providing you sample social media posts when we meet you next week, but we'd also encourage you, when you are making posts, to utilize the hashtag AADCH 2023 in all your posts, and make sure you publicly share your experiences in advocacy messages online during the event and even after. A couple tips when meeting with members of Congress and their staff. First and foremost, introduce yourself, including your name and which city or town you're from. Members really like to recognize and understand what part of the district you live in. I will say at the onset, which we'll talk more about at the breakfast next week, because many of you will be joining others from your state and or your hometown, you will need to decide who will lead the discussions in the group, and we can work through all of those logistics next week at the breakfast. Secondly, we want you to provide an overview of those network key issues that I just addressed and ask them for their support. Please share personal stories. It really provides a greater insight into how issues are impacting you personally or someone you care for. Just again, to give members and staff perspective on how these issues are impacting you as their constituent and how they can make things better. Stay focused. Please keep the conversation simple and polite. Members of Congress and or their staff really have minimal time, and so thereby we want to make sure that we stay on message and certainly respond in an appropriate manner, because oftentimes we will get approximately 15 minutes to kind of state our case and have the meeting. Show openness to reasons why a member or staff is opposed to an issue. Members may not always agree on various issues. Many possibly will because they have personal experience as well, dealing with a particular issue. And some certainly may be on the fence because they need to learn more. So again, just be openness to reasons why a member or staff member is opposed to an issue. And then of course, offer to get the answer to any questions you don't know or questions that they may have. We'd love you to get summary of what commitments the member has made. There will be feedback opportunities for you to insert that either through your phone on the Soapbox mobile tool, which will be discussed later, and or in feedback by email to me or someone on our staff. That way we can certainly follow up to those commitments and make sure that we answer any outstanding questions that a member or staff may have. Please remember to say thank you at the conclusion of your meeting. And then lastly, members love to take photos. We've gotten some great photos with our advocates and members of Congress and or staff. Include them in your social media posts. And again, remember to use the hashtag AADCH 2023. I wanted to run through briefly just the agenda for next week. As you know, those who will be joining us on May 2nd and coming into town on May 2nd, we are having a welcome reception. And during that reception, the Environmental Protection Agency will be giving an award. It's the National Environmental Leadership Award in Asthma Management, where they recognize one of our country's local asthma management programs. During registration, we will have breakfast available, and there will be a brief program that morning where we'll have speakers and again, go over some of the key issues as well as scheduling and logistics of the day. In the course of the day, there will be Capitol Hill meetings. Again, Soapbox will be scheduling for all those for you all. You will be receiving schedules tomorrow. And then certainly in the course of the day, there is the congressional lunch briefing where we'll have a number of speakers as well, one of whom is the Congressional Caucus co-chair for the Asthma and Allergy Caucus, Congresswoman Debbie Dingell, who will be coming by way of video to give remarks before our group. It will be a 1-hour lunch. There will be brown bag lunches available. Many of you may have meetings that conflict with this lunch at some point of the time, whether it's at the front end or the back end. Please just remember to come by and grab a bag lunch. They will be out and available during the course of this lunch event. I just wanted to give and highlight some of the speakers that will be presenting next week. As I mentioned, Congresswoman Debbie Dingell, who is the co-chair of the Congressional Asthma and Allergy Caucus, Dr. Kiley from the National Institutes of Health, who oversees the Lung Disease Division, Mr. Jonathan Edwards, who oversees the Office of Radiation and Indoor Air at EPA, Dr. May, who is the president of the American College of Allergy, Asthma, and Immunology, Dr. Meadows, who leads the advocacy and government affairs efforts for the college, Dr. Nancy Joseph from the National Medical Association. She is the head division chair for their allergy and asthma immunology section. And then last but not least, we have a woman who will be providing a patient testimonial, Ms. Shamika Ward, who again, you will be inspired as to why we are doing what we do once you hear of her story during our lunch event. Just some general meeting information I wanted to make sure that we touched on. Again, as I mentioned, there will be materials and handouts available to you when you check in at the registration at the beginning of the breakfast. We will have background information for you. Again, talking points, key background information, information that you will leave behind to give to those meetings and members of Congress and staff that you'll be meeting with. We'll also have a hard copy of the sample social media posts that you can utilize throughout the course of the day. I wanted to make light that there are a couple of virtual meetings as I looked at the most recent rundown of some of the schedules. I think there's about 5. With that being said, please, you can utilize your phones. If you are bringing, you're welcome to bring any type of other mobile device or laptop to do these meetings. There are a number of places around the Hill where you can kind of set up and conduct these meetings. There's cafeterias. I mean, if it's nice outside, you can even sit outside. And certainly if there are any questions, we can make arrangements for you also to come back to the hotel at the Phoenix Park Hotel to set up shop to do your meetings there. Again, there's very few of them. Some members, again, for whatever reason, they are deciding that they would prefer to do a virtual meeting. As far as your attire, it's certainly a business casual environment. I will tell you that the Senate is in session next week. The House is not in session, so there will be limited members of Congress on the House side walking around. So you may see some of the staff in a little more casual attire than they normally would be in. But again, just for the sake of our event, please come in a more business casual attire. Certainly wear comfortable shoes. There is a lot of walking. So again, ladies, if you are so desire to wear a heel, I strongly suggest one that has a little more cushion and or a block heel to be able to get around through the course of the day. As far as mask, there are some offices that do require mask, not all of them, and pretty much, the majority of them do not. So I just ask that you come prepared. I know I saw at least 2 offices that may still require mask. So again, just tuck one in your pocket to have it just in case. And then last but not least, metal detectors. They are in every entrance of the buildings. It's kind of like going to the airport. So belts and keys and some watches and jewelry will need to be removed to get through the metal detector of the building. I just wanted to give, again, perspective on these are some photos from our prior years. Our AADCH theme this year is moving toward patient-centered healthcare. It speaks to patients being empowered about their care and to bring attention to policymakers as to what is needed to support them in order to have better health outcomes. As we always say, if you've participated in any of our online campaigns, your voice is important, so please let it be heard. And with that, I am going to turn it over to Christopher Cush from Soapbox Consulting. Now, mind you, we were having a little audio issue at the beginning of the start of our webinar, so I'm hoping that Christopher, is that you, Christopher?
That's me.
Fantastic, fantastic, we're working. So the show is you.
Oh, great. Thank you, Charmaine. I appreciate it. And thank you, everybody who's coming back to town or to town for the first time. It is important that some folks show up. So there are lots and lots of important issues that the United States Congress has to deal with every single year. And they tend to deal with the ones that they see. And people who need things like research and access to care need to show up to let members of Congress know, help them understand that this is a priority. And we need to not just hope everybody's researching every issue. So I think you're playing one of the most important roles in terms of care and in terms of fighting these issues that a person can play. So congratulations. I appreciate it. Next slide. And now for a pop quiz. So here, this is a map of all the meetings we're going to do. Everybody on the call here will be meeting with your 2 senators and your representative. I'll tell you about your schedules in just a moment. You might be meeting with a couple representatives because if somebody else comes from your state, we're going to put you together. So nobody's alone and you're going to see your representative with your team from the state and maybe somebody else's representative. with your team from the state. So you're going to be together with a couple meetings, maybe a couple more than a couple meetings. Pop quiz for you. You see on this map red dots and blue dots. Red is associated with a political party in this country. I bet you know what it is. Blue is associated with a political party in this country. I bet you know what it is. The important question is, what do you say if you go into a meeting and you discover that you are represented by somebody who you did not and would not vote for? What do you say about the election? I'm hearing nothing. I'm hearing nothing but silence, and that is the right answer. So when we do these issues, thank you, Sharina. Thank you, Sharina gets it. When we do these meetings, the people who represent you. And it's not only not helpful to build a relationship that has to sustain us through a long and complex process for you to bring up anything political, it's actually not allowed because we're talking about actual legislation and actual funding. So you cannot talk about how you voted. You cannot talk about any fundraisers. You can't talk about campaign commercials. So no political discussion whatsoever. And instead, I'm going to challenge you. I'm going to take it one step further. We're going to ask you to warmly and sincerely invite anyone who you meet with to join this fight. And that could be some new members of Congress. And I'm going to show you how you identify those on your schedule. Next slide. At the close of business today, you are going to get an email from soapboxconsulting.com. We are going to send it to you. Inevitably, it will end up in a spam filter or two for some of you out there. So if you don't see it, by, let's say, 7 p.m. Eastern time in your mailbox, your regular mailbox, check your spam filter. We'll send you the code again if you still don't see it. But the idea is that it gives you access to what's called the mobile tool. The mobile tool is not an app. I'm going to say that again in case you weren't paying attention. The mobile tool is not an app. There is nothing to download. It does work on your phone with any browser. It also works on your desktop or laptop. It is simply a website, but it's a website that shows you your schedule in real time because appointments can and do change up till the day of the event. That's how Congress is. Not, we're really worried that an appointment might change. It's not that kind of thing. We're telling you there will be changes. And there are also offices that schedule late. I apologize on behalf of the United States Congress, but that is going to happen. You will see some TBAs. And by using the mobile tool, you'll be able to keep up to date with schedules that change and meetings that get scheduled a little later. In your mobile tool, you'll also see the team you've been connected with from your state. So that's everybody you'll be having the same meetings with when you come to town. And you can also preview our documents. When you look at your schedule on your mobile tool, we're going to ask you to tell Soapbox directly via email. Have your plans changed? Do you see anything that looks, like it doesn't work? Do you have limited energy and you can only do a couple meetings? If you see anything that you want to tell us now before you get on an airplane, and we'll work on it before you come to town. Next slide. Once you come to town, you're going to get another schedule. You're going to get a printed copy of your schedule. Your mobile tool will continue to work, but the printed copy, it's super easy to use. It's got a giant map on the back, so it's going to be a helpful piece of paper. It's also going to allow us to see who from your team made it to town and who didn't. So that'll help us in terms of canceling any meetings that we need to cancel if somebody doesn't show up. Your schedule will have your name in the upper right-hand corner. It'll have your mobile tool code on it. So we'll remind you about that mobile tool code. Don't worry about it. Underneath your name, it has a help desk phone number. The help desk phone number is where you can call for live assistance anytime you are on Capitol Hill. So that will be helpful throughout your day. Please remember and share with your team when you see them. If you need anything on the day of the event, Time will be of the essence. You call us. We have living people waiting to pick up the phone. Don't think you should email or text somebody and they can text somebody and they can text us. Just call us. We're waiting to help you. Your meetings will be in time order, just how they are on the mobile tool. In parentheses, it'll say who you are meeting with in each office. So it will first say the senator's name and then in parentheses who you are meeting with. If you are on the member schedule, it will say member. So that's for a senator or a representative. And that's who you will ask for when you go into the office. If it has a staff name, you are meeting with staff. And that's who you should ask for when you enter the office. And remember, as I've already told you, things can and do change while you are on the Hill. So these meetings might change a little bit. Please use the mobile tool until you get to town so that you can stay up to date. Do not take these meetings and transfer them to something like Outlook, because there will be little changes throughout the day. At the end of your meeting lines, you are able to see a couple interesting pieces of information. For those who've done it before, you'll be able to see if somebody is on a key committee. You'll be able to see the word up. If somebody is a senator who is up for re-election this cycle, they should be friendly. And you will see the word new, N-E-W, for people who just got to Congress. No, they won't know the acronyms. Yes, you will know more about these issues than they do, but their future support as champions for our issues rests on your ability to be patient and kind with new members of Congress. Those of you who've done this before and built these relationships, part of the game is starting over. Please slow your roll if you see a new member of Congress. Next slide. On the back of each printed schedule, again, that you get when you come to town, there's an easy to read map of Capitol Hill. Basically, there's 3 Senate buildings to the north of the Capitol, all connected with a basement hallway. The map will show you where the entrances are, including accessible entrances, even shows you places you can find food. Then on the south side of the Capitol, you see the same exact thing, 3 buildings for the House meetings, all connected through the basement hallways. You'll see entrances, accessible entrances, places you can find food. You get through any of those doorways and you can, using the basement hallways, get to any other building on that side of the Capitol and any other meeting you have. So we'll be on site in the morning to help you get your bearings, but this is a real easy way for you to find out, check where you are and where you're going and what the right entrance is for you when you are in town. I want to mention, when you're walking around consulting your map, there's going to be something you still use your mobile tool for. So just on the day of the event, we'll send you push notifications if something changes. And also every single meeting will have a feedback form. So that feedback form will be at the mobile tool, sboxmobile.com. And you press feedback for any meeting. You're going to tell your team some things about each and every meeting, and there's even a place you can attach a photo if the member pops in to say hello, or if you had the entire meeting with the member of Congress. So super good information for you, real simple, real helpful, just the things you need. And if all else fails, you're going to call us and get a living person to help you out. Next slide. What it looks like, and then I'll stop talking, I promise. But what it looks like is when we are all together, you're going to sit with your state. So this will be in Washington, D.C. in a week. You'll sit with your state in the morning, and I will speak a little bit, and then we will give you a state envelope. It looks like it does over to the right here. It'll have your state name on it. Inside that envelope, again, this is after we all sit down. This is not as we walk through the door, but after we all sit down. Inside that envelope, you will see individual schedules. So somebody will reach in the envelope, pull out the individual schedules and distribute them. And we'll ask that same person to do 3 things for us. If someone's not here, put that schedule back in the envelope just for that one person. If someone is here and didn't get a schedule, put a business card or something similar in the envelope. And then gather up any other questions, comments, or needs from everybody from your state, including and most importantly, if there's a meeting that nobody can attend late in the afternoon. So those 3 things we'll ask for. You will bring just one person from each state that envelope back to the help desk so we know any final adjustments we have to make. And then there's only one more thing for you to do if you're from a big state. If you're from a big state and you have more than 5 people attending your Senate meeting, you're going to have to organize that meeting a little bit. You may want to organize all your meetings. So you'll have the balance of your time that morning after you turn in the white envelope to either set up a meeting if you have a large group or just work on your meetings in general. Okay, with that, I'm going to remind you that you're going to get your mobile tool code after this webinar, and you're going to be asked to respond directly to us if you have any questions, comments, or needs. Remember to look in your spam filter if you don't see it. And also, if you email Charmaine, if anyone tells you they didn't get their code, just forward that email to Soapbox, and we will resend your code after 7 p.m. Eastern time. Okay, that's a lot of stuff. The most important thing is you come to town, you look them in the eyes and tell them your story. That's the most important stuff. All of this, we're going to be there to help you with.
And this is Christopher's info. Chris, thank you so much, as always.
Thank you.
And as he mentioned, Soapbox, and we'll have a team there next Wednesday morning to shepherd us all through on just, again, rehashing logistics and going over schedules and the like. So at this point in time.
And Charmaine,
yes,
somebody on my step has handed me a note that said I may have gotten something wrong. So did you want the schedule?
Yeah, we were going to, which I was going to say, we were going to send out schedules in the morning.
Okay.
But if they're ready enough where we can send them this evening, I think, we can go ahead and move forward. So at this point, if your team is ready to send, let's just send. And as Christopher mentioned, everyone, that, there will be some TBDs because we're still waiting to get the actual time set for your meeting. So just stand by because, in the course of the next few days, we'll get all that ironed out in regards to your meetings. And then next, I think we had a couple questions. I want to make sure that I've covered and answered everyone that asked questions. I think we got it all together. For whatever reason, my lovely, oh, here we go. My slides are a little slow here. So with that being said, here's my information. Many of you have already reached out, but reach out certainly if there's questions. As I said, there will be background information, talking points, social media samples provided to you next Wednesday. So you have those as a hard copy along with leave behinds to leave with those you're meeting with. We'll rehash this a little bit next Wednesday morning during the breakfast briefing. It looks like I may have another question or there's a hand raised. I thought I saw someone, I missed it. If whomever that is, and I apologize, if you want to go ahead and speak. Okay, I think maybe they got their question answered. But in the meantime, thanks everyone for taking time to join this prep webinar. Again, both Christopher, his team, and I will be on site next week to help you. I'm certainly available to answer questions from this point forward. Let's see, let me make sure. Oh, and yes, thank you. So yeah, we look forward to seeing you next week. We're excited to host you and have you. Again, this is easy. And as Christopher said, these members and their staff are wanting to hear from us because we can help direct policy and drive change. So again, thank you, everyone. We appreciate you all, and we'll look to see you next week. Take care.